Role of anterior chamber maintainer in ocular trauma. AC maintainer is used to reform anterior chamber by placing it at the limbus, which irrigates anterior chamber with the balanced salt solution. Collapse of the anterior chamber space can potentially result in endothelial cell damage, iris tissue damage with secondary bleeding into the anterior chamber. With collapsed AC, it is difficult to remove pigment residues, lens material from the AC. It is difficult to close the open wound when AC is collapsed. Collapsed anterior chamber can lead to endothelial cell damage while suturing the cornea, and thus AC maintainer helps in preventing corneal edema. Full thickness corneal tear extending from 7 to 10 o'clock can be easily sutured in the presence of anterior chamber maintainer with the help of 10-0-ethylone sutures. Management of the traumatic endophthalmitis which occurred due to the injury by nail in the left eye is managed easily under the presence of the anterior chamber maintainer. The intraocular maneuvers in the management of the traumatic cataract occurs entirely in the anterior chamber. Therefore, it is essential to maintain the anterior chamber depth throughout the procedure. Shallow anterior chamber depth can be decremental to the iris tissue posterior capsule and the capsular bag, which can increase the incidence of intraoperative complications. Improving anterior chamber depth helps in managing traumatic nucleus drop by preventing destabilization of the vitreous body. Decreases the risk of PVD, peripheral retinal breaks, and retinal detachment. Anterior chamber maintainer prevents intraoperative and the postoperative complications, reduces ocular morbidity, and improves post-op visual outcome.